Good morning, everyone.
Good morning.
Good morning. Hey, Julie.
Hi.
Morning.
Going.
Jody is
Hello.
going to be coming in late, so don't expect to see him just yet. So there you go.
Jacob, is Aaron going to be on here? Jacob? Let me see if I can get him in the chat. Is that you, Jacob, that just popped on the phone?
Yeah, probably the 5620.
Yeah. Is Aaron going to be on today?
Yeah, she should be. I
Okay.
sent her the email asking if she was, and she said she was.
Okay. Good morning, Eric.
Good morning. How are you?
Good.
Yeah.
Okay. So we are going to go ahead and call to order, and I'm very happy all of you could join us this morning because it's an odd day out there with the snow, and most transportation agencies are closed today. So it's great to see everyone's on here. So we will go ahead and call to order at 9:31. We do have a quorum established. We have 6 or more voting members on today. And did everybody have a chance to review the agenda?
Yeah.
Okay, so we do need to approve the agenda if anyone wants to make a motion and second.
I'll motion to approve the agenda.
I'll second. John Carroll.
Thank you. And Kristen made the motion. If we can just make sure we say our names when we do it so that when they go back to do the minutes, it makes it easier for the person having to type.
Yes.
And did everybody have a chance to review the minutes?
Yes.
Okay. And can I get a motion to approve the minutes?
Motion.
And a-
Motion to approve. John Carroll.
A second?
Second, Kristen Amundsen.
Thank you. And I totally forgot to vote on the agenda, so we will combine the two motions as just a general consensus approval for the agenda and minutes as a group. All those in favor?
Aye.
Any opposed? Thanks. And I do want to apologize ahead of time. My lovely mother moved in on Saturday and she brought along this psychotic cat that is still adapting to living in a new home. So I've never done a Zoom meeting with a cat before. And if you hear it screaming, it's just because it's like still nervous. I'm not doing anything to the cat. It's a very weird cat. I'm not that thrilled with this cat, if you can't tell. We don't have any new, oh, I'm sorry. Are there any public comments not on the agenda? And we do have an update to the agenda. Metro Mobility will be presenting their survey study today for the group, and we will have them present right after Goodwill as a provider presentation. There are no new appointments for membership this month. The one thing we do need to vote on today is officer nominations for the 2021 term. Currently, I'm chair, Dick is vice chair, and Miley is second vice chair. And Miley's no longer with her agency, and so we will need first of all, anybody can put forth any nominations, like if you'd like chair, go ahead and nominate someone. Or if we do want to accept the current slate with a new second chair, we would need a nomination for the second vice chair position. Don't all jump in at once. Okay, well, since I'm so shy, I would like to nominate Phil Van Horn from Invita, because look at his smiling face, he's thrilled, as second vice chair for Miley's position, because he does attend all the meetings and he is very up to date on specialized transit in our region.
Thank you.
You're welcome.
Can you guys hear me, by the way?
Yes.
Okay, cool.
So awkwardly, since I'm chair, I guess the slate that we have, if there's nobody wants to make any other nominations, would be myself as chair, Dick as continued second or vice chair, and Phil as second vice chair. That's the current slate. If anybody would like to comment or make any additional nominations or motion for it to go forward.
Kristen Amundson, I'll motion for it to go forward.
John Carroll, I can second that. Good team.
Yes.
All those in favor of the slate presented?
Aye.
Aye.
And any opposed? Because if you oppose, that means you get to be chair. So good call. So that will go forward for the 2021 will be myself, Dick, and Phil. So thank you, Phil, because you didn't know I was going to nominate you. So thank you extra much.
Great job.
So our first presentation today is going to be Kristen with Goodwill.
Okay. I am set. So everyone hear me okay? Yep. I have actually never done like my own formal PowerPoint with sharing. So do I have to get permission to share or should I just try it?
Give it a try. It should work for you.
I think I got it. Sweet. Can you all see that presentation? Okay. Let me do the slideshow. Okay, you guys can see everything okay, or should I put it back in the other mode, or is this okay?
It looks great.
Okay, so thank you for the opportunity to present. I think I was nominated to, because it's been a while for Goodwill. So let me just explain kind of my role. I've been with Goodwill for 9 years, and I've probably been involved with the MCC off and on for about 7. I'm actually more of a business development person with Goodwill, but I've done a lot with grants and old JARC and New Freedom and 5310 and all of that over the years. And so because our programs are so different, they kind of wanted me to be the consistent person to attend. And then, you know, I can always get you the information. We have several programs and different managers. And so that's kind of how I started trying to become more involved. So I'll just apologize at the top that I don't always know the answers to everything transportation, but I definitely have a passion for it and can always get you guys connected. So with that, I'm just going to do a brief introduction on Goodwill and our mission. A lot of people, there's a lot out there on Goodwills in general. So I'm going to do kind of a little Mythbusters quick to just so you kind of know what our Goodwill is like. There's different Goodwills across the country. So I'll do a quick overview of that. Then I'll talk about the transportation programs that we have. And then I'll touch briefly on our fleet maintenance division that we have as a way to support the MCC members, if that is something that interests you guys. And then questions and answers. So many of you guys have maybe heard that Goodwill is now Goodwill of Colorado. Discover Goodwill is headquartered in Colorado Springs. And in 2019 of August, or August 2019, we merged with Denver's Goodwill. So their thought behind that was Goodwills all have their own territory, and we only had 2 in the state, and we wanted to leverage our resources and become one big Goodwill. So we're still kind of the hub in Colorado Springs. We kind of inherited Denver, and we still have a Denver office and then the Colorado Springs office, but we're more of the hub here. And then as you can see on the map, we have stores across the state. The farthest is Grand Junction. We have stores in Canyon City and Pueblo. And then what we try to do is, as a new store gets developed, if it's a new territory, we try to expand our mission programs to those areas. So our mission statement is, we are dedicated to helping people reach their highest level of personal and economic independence. So that can be anyone across the board. We're all about independence. And so some of our facts, or fun facts that, did you know, Goodwill is a nonprofit, and so our stores and our programs support Coloradans in need. So we just always like to clarify, even though you might just know our retail side, we are in fact a nonprofit, and I'll go into a little bit more about our programs and how the money gets generated for our programs. Carla Grazier is our president and CEO. So she is our CEO of Goodwill of Colorado. And we are a member of Goodwill International, but we're almost like a franchise. Every Goodwill has their own territory, their own programs that are fit for their community. So I grew up in small town Minnesota, and we just had a little store, and they had employment programs, and that's about all they did. Whereas our Goodwill has about probably over 25 different community programs serving a wide population. And so she doesn't make $1 million. Sometimes you see stuff in the news where different CEOs, different Goodwills have been in the news for different things, and that's not true on some of their salaries. All of that is public information. So, and again, we're an independent organization, so all of the Goodwills across the country are very different, but we are managed and, checked by Goodwill International. We have to, follow their policies. A lot of our employees have disabilities. We have contract sites where we have a commercial laundry, we have janitorial services, and there might be some individuals with disabilities in our stores. And just so everyone knows, everyone makes minimum wage or higher. And many of our employees on our contracts actually make they've been making federal wages for years, plus really great benefits and then a retirement plan. So sometimes you hear that Goodwills have paid people a commensurate wage certificate where it's below minimum wage, and that is not the case. So everyone makes minimum wage or better. And then lastly, you might have known someone we helped, and that kind of shows me the next screen here is kind of an annual snapshot of how many people we serve. 90% of the funds from our stores get put back into our programs. So that could be our senior home care programs, our job sites for folks with disabilities. Most of our work is job training, employment programs. We work with a lot of our municipalities, counties, and we do a ton of case management, getting people back into the workforce, whether they've had a background and some, trouble getting in the workforce, or really just need help finding a career path. We do IT training. We do a lot of training where maybe they're not a fit to go to college, but we do a lot of vocational trainings to get them back into the workforce fast. And we're all about getting them good paying wages to get back and be independent. So I won't read all of this to you, but you can kind of see some of the programs, our retail centers. We do a lot of e-recycling donations. And so we very much appreciate all the donations that Goodwill gets, and we turn the revenue goes back into our program. So I'll get to the meat of what you guys might want to know about is the transportation program. So our main program, and this is under Andrew Smith, is Goodwill's Community Transportation, and this is only a couple years old, but we do door-through-door service, and so it's mostly traveling to appointments, community outings, and we have the wheelchair capacity for all of the vehicles, so we do accommodate a lot of different sizes. Most of our work is Medicaid, NEMT, but we do insurance and private pay as well. We have, at the moment, we have 16 5-passenger vans. And then typically what they told me was that we do a 20-mile transport radius if it's insurance, but we have an unlimited radius for private pay. And last year they did about 20,000-ish rides last year for Goodwills. And so we do have a dispatch line, and that's between the hours of 7 a.m. to 7 p.m. You can call, and then you can see, I'm gonna move your guys' faces just a second, blocking my screen. We typically can transport from 3 a.m. to 10 p.m. or by appointment. And COVID has definitely had a big impact on our day programs, which a lot of you guys help and partner with us and transport folks to our programs. But we have 3. We have Possibilities, and that is at our 1460 Garden of the Gods Road, the picture right there that you see, and Voyages. Those 2 programs are at that location. And then Journeys is another day program located on Academy in Montebello. And so right now, because of COVID and our census, we are definitely down capacity wise. We're in that category of 25 people or 25%, whichever is less. And so Possibilities and Journeys, who support folks with developmental disabilities, it's all adults, but they usually need a lot of supervision, maybe even line of sight where it's one-on-one care. And so those programs are combined right now at the Garden of the Gods location. On a normal year, we have 3 separate facilities. Voyages is also at this one, and that is more for seniors memory care. And so right now they have about 17 people attending that program. And so what they've done is they've run different program schedules, shorter days to try to accommodate and make sure, we're accommodating the people, but also following the social distancing guidelines. And so we do have our routes kind of consolidated right now. So for that transportation program, there's about 2 Goodwill routes that we are running pretty much for the Medicaid clients under the EBD waiver. And then we also partner with other agencies in town to help provide transportation and connect them. And then lastly, it's kind of a unique program. It used to be kind of more under the JARC program, the Job Access, where we have a Ability One contract at the Air Force Academy. It employs probably 75 individuals with very significant disabilities that probably wouldn't have a job in the community because we provide case management, coaching, and unfortunately there's no public transportation that goes to the Air Force. So what we do is we pick them up in the morning at their door, and then at the end of their shift, we drop them off at a central location, and they either take Mountain Metro home or they get rides from their family members or another method. So it's timed out right because they start work very early in the morning to the Air Force Academy. So it's about timing and logistics too. But these folks get different case management, on the job coaching, and we've been doing that since 1994, and it's just a service that Goodwill provides. That there's no funding for that or anything, but we definitely want to make sure people get on base. And there's a picture of Charlie. He got the certificate. He was very, very excited to get that at our Christmas MCC meeting. So he was very excited to have that. And then lastly, just want to put out there, a lot of you guys are amazing partners with us on our fleet maintenance division. I just wanted to let you guys know we do pretty much service everything at Goodwill. We've been doing our vehicles for 30 years, our own Goodwill vehicles, and about the last 8 years we partnered with other community partners to provide them affordable mechanic vehicle maintenance service. So we pretty much do everything in-house. Tractor trailers, box trucks, we're really good at wheelchair lifts, the small buses, passenger vans like that. We are ASCE certified. So we have 2 very experienced mechanics, and I don't know how they do it, but somehow they're able to have really great turnaround and same day service with just the 2. But we do also perform DOT and PUC inspections if that's something that people just need, that's all they need. We can be a outlet for that. And many folks have told us, our pricing is honest. We tell people it's going to take us X amount of time. We're not going to say, oh, it's a 4-hour window and then charge you for that. So we're going to tell you what our estimate is and charge you for the actual time that it takes. And right now we just do business to business services. So we're definitely looking to expand partners. If you know of anyone that's wanting to get a new mechanic or use someone, we don't do like individual vehicles, like on an individual basis, but business to business partnerships. So. So there's my contact information. Another contact for you is Andrew Smith. He's our transportation manager for Goodwills. So if you have questions on dispatching, anything that they do, I'm happy to connect you. And he's apologized. He was going to be on the call today, but he had to take some time off. And so he's definitely a resource though, and I can always connect you guys. But thank you for the opportunity to present. And we're very grateful for all of the partners that we have and the support that the MCC provides. So I don't know if you guys have any questions. Feel free.
Anyone have any
Kristen?
comments for Kristen? I will let you know, Diana doesn't have microphone, and she did post in the comments that Mike at Goodwill Maintenance is amazing.
Oh.
or awesome.
Thank you. I do pass all the kudos on to Mike and Bob. So thank you guys. That makes their day.
I'll
Hey,
tell you,
Kristen?
our experience with your Goodwill Maintenance has been absolutely phenomenal. Not only is your pricing fair and you can actually fix wheelchairs, unlike some of our vehicles that we've taken to other places, it's really nice to get it back actually fixed.
Well,
But
great.
your staff goes above and beyond. We had a vehicle that was still under warranty, and the issue was a warranty issue. And Goodwill actually called, set up the warranty fixed, took the vehicle to the dealership, and handled it all for us. So you guys don't charge if there is
Cool.
another option. And then I also wanted to let you know that Sharon Thompson on City of Fountain City Council, as well as a PPACG board member, has texted me pictures of your new vans up at the location on Gar and the Gods. And she thinks
Okay.
absolutely beautiful and loves the way you guys did your wrapping of the vehicles, because it allows
Oh,
for some privacy of the consumers on your vans. And so she just thinks they look very nice and absolutely gorgeous. So I wanted to pass
oh.
it along.
Thank you. I will definitely let them know. Yeah, they kind of took a tagline. We have a home care program called Your Life, Your Way. And so when they did Goodwills, it's called Your Ride, Your Way. So they kind of tried to loop that in, but thank you. I didn't even think about all of the privacy. That's great.
Yeah.
Sorry, someone else had a
Kristen?
question? Yeah.
Yeah, Kristen, this is Jacob with Mountain Metro Transit. Wonder if I get a little more information on your Goodwills community transportation. Wondering what are your what's the qualifications for somebody to get on that?
As far as I know, it's open to anyone. So, Goodwill in the past has definitely been more closed door on some of our programs, but it's anyone. I don't know as much about the funding. I know most of our revenue is Medicaid funded, so they would maybe walk through that qualification. But I mean, you can private pay, people can do whatever they want. And it can be, with COVID, I don't know, maybe family members ride together, but otherwise they used to do group stuff, but it's pretty much just individual. So yeah, do you want me to reach out to you, and do you have any other specifics that I could pass on to Andrew, or I could call their dispatch driver as well right now?
Actually, if you could just have connecting with Andrew. I actually think I have his email. I'm pretty sure I spoke with him in the past because I'm gonna have a lot of specific questions. But no, it's good to hear that you guys have an open door program because we are always kind of under the impression for the most part that everything was closed door. So the fact that that exists could be some information I can get to my folks when we can't do a ride under the assumption that they would qualify for your program.
Yes, it should. We partner a lot with senior facilities too. So if they needed group rides in the past, but yes, they're absolutely open door. And then in the past with our rehab transportation, the ones going to our day programs, because of COVID, we're scaled back, but that one is a little more unique where sometimes we're able to partner more with CDOT and other groups because we go so in the rural areas. So that's a little closed door still, but we do tend to branch out and go where the gaps need to be filled. But Goodwills is definitely the one to serve anyone. So
Great, thank you.
yeah.
Jacob, when you get those answers, can you send it out to the whole MCC group so that all the transportation providers know what the qualifications are for referrals?
Are you referring to our qualifications for referrals
No, once you talk
or
to
Goodwill?
Andrew to find out what the Goodwill requirements are, that way if like us or Invita or Silver Key can't pick up a ride, but we know that person would be able to qualify through Goodwill, it just gives the whole community another referral source.
Actually, I would turn that back on Kristen or Laura. If one of you guys could take care of that.
I can certainly do that. I was just going to say that. Andrew is out until February 1st. He connected me with his dispatch driver and lead driver, and I can just see if they have a little sheet or anything. I know we put some information in the old MCC like brochures that we had. So I just need to double check that stuff. But I don't know how, when you guys ask your questions on what qualifications are, I just need to see what it is.
Okay.
But I will find out, if not, hopefully this week, if not by February 1st when he's back.
Sounds great. Thank you.
Yep. Anyone else?
Okay, this is Sharon Brown. I represent Fountain, and I'm sorry I had to join late. How were the donations at Christmas with the kettle?
With the kettle.
Or when you have kettles all over the world.
That's
it gets
Salvation
trouble.
Oh,
Army.
that's Salvation Army.
Oh, I'm sorry. You're right. My
That's okay.
mistake. I'm sorry.
That's okay. One thing I will note, that's a good
Oh, yeah,
question
your
though.
Goodwill.
If someone donates to Goodwill for a very specific reason, we have a foundation and that money goes to the specific program or cause that you like. So different, Salvation Army is different, but just to put that out
Right.
there is
Sorry.
a way that if we're fundraising for a specific program, we used to do veteran training and different things that would go specifically to that program.
Okay. Okay. Thank you.
Any other questions or comments for Kristen? Thank you so much for presenting today, Kristen. I think you busted a lot of myths that we maybe had about Goodwill and the availability. So thank you.
Thank you guys. I appreciate it.
And we have Erin joining us from the City of Colorado Springs to present on the city transit survey that went out. So we look forward to, I already got a sneak preview on PPACG's board meeting, and it was a very well done survey considering we're in the middle of COVID. So thank you, Erin, for joining us to share those results with the group.
Thanks, Jolene. Let's see. I'm going to try to share my screen, and it looks like it's going to work. You never know. Okay. Does it look like a PowerPoint?
Yes.
Okay, good stuff. So I'll go ahead and do the slideshow thing here. Okay. So first of all, thank you so much for having me. Just want to give a quick overview of our 2020 Writer Survey. Oops, hit the wrong button. And just kind of why we do this. One, it's to basically get a report card from our writers to see how we're doing. And the second is to collect data that we then use for analyses, planning decisions, all sorts of other things. So it's a really beneficial thing to do. We try to do it at least once every 3 years, probably a little bit more often as our system kind of stabilizes. In the past couple of years, we've been adding a lot of service, so it didn't really make sense to survey so often because nobody was used to anything. So just quickly, most of this has to do with fixed route, and that is because we managed to do the onboard fixed route survey right before the pandemic really kicked off. So we got it in under the wire. We were going to do Metro Mobility about the same time, but logistically with everybody closing down, things like that, didn't work out. So we had to wait till June to do it. And when we did the mobility survey, it was limited. We didn't want to ask a lot of questions about like, how's your ride, things like that, because people really weren't riding. So we just, we waited. So just quickly, the fixed route survey instrument, paper survey, 33 questions. broke it up into several sections. 8 questions on that day's bus ride. Where did you start? Where did you go? How'd you get to the bus? How'd you pay? 5 on general transit use. So how often do you take the bus for these types of trips? 5 on perception. So that is our report card. How do you feel that we're doing? And then 14 on demographics. So age, gender, income, things like that. And that is the data that we use probably most with planning decisions beyond the report card data, just to make sure that we are including every population that we need to. So as I mentioned before, we ended up doing the onboard survey basically the week before everything kind of started shutting down. So it was amazing and well-timed because we managed to get a statistically significant sample. So we know that the results are good to go. So what did we find? Fixed route rider demographics. And sorry if you can hear it's like puppy playtime. They're biting each other in the other room. So for the most part, our fixed route ridership is fairly millennial. And we saw that in the 2017 survey as well. It's slightly less millennial than it was in 2017. Gen Z is catching up. It about doubled, which makes sense because Gen Z is getting older. They're starting to take the bus more often, maybe by themselves, things like that. The other key takeaway is that fixed route is extremely male leaning. So in 2017, we always had more male riders than female riders, but that gap has widened. So we're actually at a 3-to-2 ratio right now, which is kind of interesting. And that is contrary to national trends. Most riders nationally are female. So as far as employment, most of our riders are employed full or part-time.
I have a question. Do we know why in this area it's so leaning more towards males?
You know, we don't specifically, but that is something that we need to work on. And I'll show you something that kind of maybe hints at it a little later in the presentation. So for the most part, we're mostly employed fixed route ridership wise. The riders who are employed are mostly employed in the leisure and hospitality industry, which follows 2017. As far as the ridership demographics, we are incredibly low income. So about 80% of our riders reported total household incomes in 2019 less than $40,000. So it is a vulnerable population that we serve. The graph on the right shows that basically the household size of our riders and the chances of being low income are very well correlated. The larger the household, the more likely the household is to be low income. And the little cars there in the middle, if we start with the able to drive, which is kind of like almost dead center, you can see that yes is purple and no is yellow. So most of our riders, the majority, are able to drive. And then if you go up from there, a little less than half have a driver's license. And then as we go to the left, less and less people own a vehicle or have access to a vehicle. So one of the questions I've gotten on this presentation is, well, why do more people own a vehicle than like have access to a vehicle? And it's potentially because, you know, it broke down. Maybe it's a 1-car household and the other person in that household has the car today, things like that. So it kind of shows, it doesn't show causality, but it does show that maybe low income has an effect on our ridership as far as being able to access vehicles. We grouped riders into 3 different types, and we did this in the 2017 survey. So we continued on so that we could compare and contrast. It used to be that transit ridership was shown as like your dependent rider and your choice rider, but that's really not the case. So it's not that you have this big giant resource of people who just depend on you for everything, and no matter how bad your service is, you can just continue on. It's not that at all. So looking at it through a different lens, we have a lot of all-purpose riders, which means that they use the bus for about everything. So that's the majority of our ridership. Our sole purpose riders usually use it for one or more, but generally one purpose, and commuting is the biggest one. And then occasional riders, as the name would suggest, ride occasionally. So they go shopping, maybe they take the bus when the car's in the shop, you never know. A lot of Route 33 or the Free Manitou shuttle riders are occasional riders. So this graph shows how people access the bus and then access their destinations from the bus. One thing is walking is not included in this because walking is by far and away the most used method. So this is kind of like everything but walking. So you can see that there's a bunch of different ways people access the bus. Route 33 down at the bottom, lots of people are more likely to have driven themselves and parked in the free or the paid lots and then ridden the shuttle up to the incline or wherever. Fare payments, we like to look at this as well, especially if we're thinking about restructuring fare, any types of changes to that. So we want to look at who uses what kind of fare. For the most part, single ride or cash is the most used method. 31-day tickets are next, and the little call out to the left shows it by generation. So members of the boomer and silent generation are more likely to pay with a 31-day ticket than the rest. Could be that they have more resources to buy the ticket up front in the month and use it all month. It could also be that once riders hit 60 years old, they qualify for half fare. So it makes it a bit more attractive. We also asked about mobile ticketing, which is one of our initiatives for the year. And we were curious if there was any correlation between having a data plan and being likely to use mobile ticketing. We actually found no correlation. What did correlate though was the younger the rider, the more likely he or she would be to use mobile ticketing. So, which, you know, kind of makes sense. And one of the consultants that we worked with identified that as a really good thing to maintain ridership. So if we can get our riders in early, make it easy for them to do what they need to do, cater to their technology needs, that's a great way to maintain ridership going forward. So this kind of gets at potentially the male-female thing. This is our report card, and it's our quadrant analysis. So up top are high satisfaction areas, down bottom are low satisfaction. And then when you look at the right, it's high importance, and to the left is low importance. So in our strengths area, we have 3 big strengths: safety on the bus, safety at bus stops, and convenience of transfers. So those are those high importance, high satisfaction type areas. If I'm going to toggle next to this next slide, which you can kind of see. So E, which is the safety at bus stops and facilities, males, which is a square, find it to be a strength, but female riders find it to be a challenge. So it's very important, but low satisfaction for females. So that's one of those things that we've looked at: the widening gap, the less satisfied female riders. So we're going to look into that. We're going to create a task force and look into exactly why potentially we're losing female riders. So the rest of it, you know, comfort at the bus stops, comfort of the bus, it's an opportunity. Maybe we've gotten some comments here and there that, you know, like your seats really aren't that comfortable. So it's a matter of, are they easy to clean? Do they wear better? Things like that. So it's all this kind of like trade-off opportunity cost type stuff that we have to look at when we're buying new buses, creating new services, things like that. So again, that's broken down by gender. So back to our Metro Mobility survey. And this was a telephone survey that we did in June, the last like 3 weeks of June. And it was delayed because of the pandemic, but we were able to at least get some demographics and a quick snapshot. So mobility clients are more likely to be retired or unable to work than our fixed route clientele. It's about the same as far as income though, maybe slightly more low income than our average fixed route rider. And we asked a bunch of, you know, how do you make your reservation? Most of it's telephone, which I personally found kind of interesting because if you look at the bar graph that shows how they pay, there's a pretty good percentage who pay online with prepaid accounts. But if you look over at the how customers make reservations graph, only 10% make reservations via the web. So that's kind of interesting to me. I mean, I would think that if you were just on it, you'd just do it all there, but that's the millennial in me. So subscription use, we ask, are you familiar with it? How are you going to use it? Subscriptions for Metro Mobility are 3 days per week from the same origin to the same destination. So it could just be that people aren't really doing that so much anymore. Down here, the orange kind of bar chart at the bottom shows how frequent people use Metro Mobility. And we have a pretty good percentage who use it regularly. So it shows you what kind of, how important the survey is, or the service is to our clients. So with that, our full survey results are available on the web, and I can definitely send out this link or paste it in the chat box, but you can look through it. There's a survey in brief, and then there's also the full enchilada that you can read. That one's kind of cool because in the appendix, it's got all of the uncensored comments that we received from our onboard survey. So if you'd like some light reading, some of them are kind of a chuckle, but I would recommend doing that. So any questions?
Nope.
Erin, I want to thank you for presenting, and anyone that's funded through PPACG does annual surveys. So we all completely understand those uncensored comments, and they are always a fun time to read. So I think everyone here will understand where those comments are coming from, not the majority of your writers by any means. While I do have Metro Mobility here, because we have a lot of mobility staff on the line right now, we have Craig, you, and Jacob. I had COVID in November, and then we didn't have a meeting in December. I just wanted to thank you guys and also let the group know as a whole that when El Paso County Health Department opened a new location in the city of Fountain to help, because, you know, currently I was only up off Gar and the Gods. So really, people that use a lot of El Paso County Health Department Human Services don't normally live near Garden of the Gods. So this does make it more accessible to the community and gives people options. And Metro Mobility, Mountain Metro Transit System has worked with Fountain Municipal Transit System, and we now have a transfer point where MMT, I'm just gonna say MMT, FMT can now ride down from the city of Colorado Springs and transfer to FMT and then vice versa back. And if people were on MMT buses, they're not going to be charged a new fare when they transfer to FMT if they're utilizing El Paso County services. And so I just want to thank you guys for working so cohesively with FMT. We dispatch FMT, so we were on that call, and it was such a great partnership and signage, and just allows accessibility for El Paso County residents as a whole to access services across the entire county now. So thank you guys so much.
So, yeah, this is Craig Blewett. Just to quickly respond, I'm with Mountain Metro and a colleague of Aaron's and Jacobs. Yeah, that was a great collaboration, Jolene. And the cool part was we figured out what it needed to be done pretty quickly, and we did it really quickly. So I believe is all in place and up and running before as the facility opened. And so we thought that was important, and just to, as you say, make sure we have good access from people's homes to the health services and other government services they need.
Yeah, I want to give both sides accolades, because that's two government entities coming together. And I used to work in the government, so usually, stuff never happens quickly. And those two organizations came together and made it happen for writers in less than a month. So
Yep.
you guys did a fantastic job. Thank you so much, Craig.
You bet. Thank you.
And you're getting rounds of applause. Just people are muted, so you can't hear it, but I saw it.
Steps forward, right? Steps forward.
Yes. And then next we have on the, oh, I'm sorry. Did anybody else have comments for MMT? I love your guys' informatics on your slideshow too. They're really easy to read. So next up on the agenda, we have Laura with mobility coordination updates.
Hey guys, I just have a few things to talk through because I know we don't have a lot of time, but to give you an update on where we are in transitioning with 5310, we have actually have an approved program management plan, and that program management plan is available to everyone. I can send it out to the whole group. So that is one extra step that we have been able to take with FTA. We're in the process of trying to contract with our current providers, which some of you guys are on the phone. But I do want to let you guys know that we're kind of in this 6-month transition period with the program going from MMT to PPACG. And so we're in this intermediate time frame where we are going to be working with the current providers who have been contracting with MMT for quite some time to provide services. But we will be launching our full coffer projects for the full the program that we've written out a plan for. We'll be launching that towards the end of February, early March. And so be on the lookout for that. I'll definitely be in communication with the group when we do that. Those of you who may be interested in what 5310 is, you can go to the FTA's website, which is, I think it's transit, I'll send it out, transit.dot.gov. And so there's some information there on eligibility and whatnot with 5310. The other thing I want to talk to you guys about briefly and just plant a seed. And I know Eric is on the line, and so is Melissa. We attended a meeting last week with the health department as well as UC Health and other healthcare providers who are working on the vaccination of the population of El Paso County right now and other counties too. And so the takeaways from that meeting is there's just a lot of work in trying to figure out the logistics of how to communicate to our senior population or those that are eligible right now for vaccines, what to communicate to them, what sites are available to them, how do they get signed up on a list. As you know, there's just a lot of questions out there. And I just want to let people know that they are working through a lot of that. I will send out after this, if you guys haven't received information from the health department, they put together some lists, as well as we have some links available to you guys to share with your clients. There has been a question amongst several members of this group as to when their drivers may be eligible to get vaccinated. And so if you guys have seen the progression of vaccinations of who gets it when, we're in 1B. And 1A was really taking care of the healthcare providers. 1B is taking care of the senior population, but also essential workers. In 1B, as it's described, it has the senior population up top, and then there's a second line in between that has the essential workers. So there's two phases to 1B. So I have been told by the health department and MMT concurred that our drivers should be eligible to start getting vaccinated in March. And so I just want to let you guys know that I'm staying on top of that and trying to make for sure that we have the correct information for you guys. I'm also trying to figure out, once we get to March, how do they get signed up? And so I will be communicating that with you guys. So that also going into one other thing. Eric and Melissa and I on that call last week, I heard this overarching, challenge amongst providers of social services saying, how do we get vaccines to people, and how do we get people to vaccines? And that a huge thing kind of overwhelmed me, because I was just like, well, we're transportation providers. We have transportation providers that are a part of our network. And how do we mobilize ourselves, and what resources do we need in order to provide that service? Should the healthcare providers be able to figure out how to work with us? I know that Silver Key has been reached out to to help out with, I believe, UC Health on some initiatives. But if it's something that this group is willing to, but needs resources to do so, I want to be able to communicate in these types of meetings the longingness of wanting to help from this group with this situation, but also communicate the resources that we need as a group in order to do so. And so I want to plant the seed with you guys to start thinking about how we may be able to help in this case. And Jason, I saw you popped on, but how we may be able to help as a network with this situation, but also think through the resources that you may need in order to help out with that. Because ultimately, I know that this comes at a cost. And so I want to be able to communicate that effectively with the logistical group trying to figure out how to get these vaccines out. Jason, do you have a comment?
I do. Thank you, Laura, for bringing that forward. And just so you know, I know Eric is on the line as well. One of the things is, you're right, Silver Key has been connecting with UC Health to figure these pieces and parts out about how to get people access to various immunization options. And what I just want to share with the group is that we also have been working with some insurance entities, for instance, like Kaiser, who are looking to get their members that need to be able to have access as well. And so, Laura, when you say, kind of a community solution around this and the way the different transportation teams can come forward with that, I agree with that. And just also know that there, I think, some entry points through the system that might be a little bit different. And unfortunately, each one of them have a nuance about the way we partner, what that looks like, how do we meet their requirements. And so the reason I share that is because it'd be great to have a larger system process around this. Unfortunately, with the way the different funding streams and the different insurers and the different options that are coming forward, I think it's going to be more nuanced than that. And so maybe even next MCC, Jolene, maybe we could kind of brief each other about what the practices that we learn. I won't say best practices because I don't think we're gonna have time to learn that, but the practices that we learn as we're partnering through. So that may be something to consider because it is nuanced with each one of the ones that have outreached us at this point.
So we're actually meeting with El Paso Health Department this afternoon to potentially become a vaccination site for seniors. Because I think one of the big issues we're going to see in the community, especially, I'm trying to think of how to say this politically correct, how the vaccinations have become a political issue. And then given our political landscape of Colorado Springs, a lot of our seniors are not very trusting of the government. So if we can have providers whom the seniors have that personal relationship with saying, come to the building and get vaccinated, I think we're going to see a higher percentage of seniors getting vaccinated if it's with someone outside of the government per se. And then our biggest issue is we're happy to take people to get the vaccine. However, we can only have 1 to 2 riders per vehicle. And my drivers are all 65 and older. So trying to tell like a 69-year-old, you're too young for the vaccine, but you have to sit in the vehicle not only for the vaccine, but then the 15-minute wait period. Like and that's what I'm talking with the health department is the people taking people to get vaccines should fall under the healthcare 1A section because they are an essential piece of the healthcare system. And so that's the other part we're talking about. Because today the state released like the next, even though 1B is supposed to be this whole category and include public and specialized transit providers, then they went to the 70 and older, and now the next one is teachers and childcare workers. So they keep rolling it out, which is fine. I'm happy I'm not the one making this decision, but we're just going to try and push for our drivers under the healthcare worker section, because without our drivers, everyone on here today, I mean, that's where seniors and disabled people are getting their food, their medicine, their vaccinations, their COVID testing, all the way from the small agencies to MMT. This is who's ensuring that the most vulnerable are being taken care of during the pandemic. So we're going to push under the healthcare piece, and I'll let you know. Sometimes I talk too much, but I'll try and be persuasive with that conversation, because I do think our drivers across the board are putting themselves more at risk than doctors. No doctor or nurse is spending more than 15 minutes with a patient. And our drivers are on vehicles for, it could be up for, especially Craig's drivers, you could have one person on a vehicle for over an hour in the shared airspace. Like, we're lucky enough to only have 1 to 2 passengers. But the larger the system, the longer people are in that shared airspace. So we'll try and push. And if we can become a vaccination site, I will send you guys out the information for that.
Hey, Jolene, real quick, this is Craig with Mountain Metro. So this is a hugely important effort to get access to the vaccine for our population. From the pandemic and community healthcare. Can you keep us apprised in terms of your assessments of community needs and maybe our potential role in assisting with that? We'd be happy to do that. Of course, a fixed route bus is probably an option for a lot of folks. Yeah. But there might be, the supplemental, complementary type services as well. Mm-hmm. And if there's needs out there, I think we'd like to see what we can do to help as well.
Well, and my mom works, since she moved in, now I feel like I can give her ass like she's a board member, like, so Mom, this is what I need from you today. But she works for a federally funded healthcare center in another county. And I actually asked her if they'd be willing to send a nurse with a vaccine if that county has more vaccine than like our county does. Right. Because they are state dispersed. We're not smuggling. It's not illegal or anything like that. So she's going to work on maybe a potential for that, because they are neighboring counties. And when we talk about transportation and, the spread of the vaccine, the virus, it doesn't just stay like per county. Like I drive across counties every day. So I'll also keep you up to date on that, because if they say yes for my agency, I'll let you know a contact to maybe spread that out, because they have to open them in packs of 10. And so if I can send 10 staff at a time, then they don't waste any vaccine when they open it. And it becomes a much more efficient model of group vaccines for our drivers than one-offs at a time. But I do highly recommend splitting your staff, just due to some of the side effects of vaccines. My mom actually had to close a clinic today because they got their second vaccine, and the majority of people were ill today. And so what they're doing is they're only vaccinating their staff on Fridays for potential side effects. So when you're looking at it for your agency, I would really recommend, and that is a best practice model right now, is splitting your staff so that if there is side effects, you don't wipe out your whole agency in one day. And then also doing it where they have some time off to be able to recover and not feel pressured to have to work with any symptoms.
Yeah, all good stuff. And I know that Jacob and our contractors have been in contact with the county health as well. And we got to get this laid out well for the drivers for sure. And then any role in terms of other people in the community and getting access to the vaccine. I mean, you'd hate to see the story where people didn't get the vaccine because they couldn't get there, right?
Right.
Or it couldn't get to them one way or the other. So just keep us apprised and keep us in the thoughts. And if there's a role for us, let us know.
Okay, will do. Because we had even thought about like if we could drive around a nurse to the people that don't have access to transportation. But the problem is the vaccine is so temperature sensitive that you can't really do like a mobile vaccine, because otherwise we could do that. And I think all the transportation providers would be willing, but it's such a temperature sensitive vaccine that makes it more difficult.
I think our drivers would like the chance to go really fast, and the excuse would be they're trying to get it while it's still in temperature, right?
I think all our drivers would like, I would probably volunteer to drive that day, Craig, because I love putting the pedal to the metal. That's why I don't drive unless all my drivers are sick.
We need a bunch of.
What I said to Jolene also applies to you, Laura, in terms of your role as the mobility coordinator and coordinating the region's efforts. If there's a role for us, please let us know.
Yeah, I think, Eric from 211 and I are trying to figure out how to get more within the logistics side of the group that's working on this. We met primarily with the communications people last week. And so I think that the logistics side is where we really play a role in. And so we're just trying to find the right people to meet with in terms of that. I know that also there's just a lot of moving parts, specifically with the change in our president. And so there's now more of a national rollout to this, and involving FEMA is a huge deal. I mean, coming as a disaster relief worker for many years, what's been going through my head this whole time is we need to treat this like a natural disaster. FEMA and our disaster relief agencies are used to mass distribution. And so I think that there's going to be a lot of changes in the next few weeks. And I think that's also kind of playing into some of this challenge on the local level of deciding what our approach is. And so I will keep you guys updated on the levels that we're working within, and also make for sure that you're bringing to me some of the things that come across your mind that may be a challenge for clients, but also a potential solution. And I would like to share those. So.
Sure. What I'm kind of reading is that seniors tend to be uninformed and have less tools to communicate, right, and get their reservations. They don't have computers or whatever, and you saw from the survey from what Aaron presented that a lot of our customers are low income, and that's another group that tends to be underserved, right? And I just thinking on top of my head of we'll add to our marketing campaign access to vaccine sites. Now, whatever those turn out to be, what's the best place to direct them to? But we do a lot of CVC pharmacies and Walgreens and Walmarts and all that kind of stuff. We do about a bazillion of those on our on our route system. So just letting people know that that's another option that they can use if that's what it's going to take.
Yep.
So Craig, I have a question for you because, you know, us and Vida and Silver Key can do a mass route match call when we have more information to disseminate. For your people that pay online or do online reservations, is there an email system where if there is a mass community, because I think if we work together as an entire transit system, not specialized or fixed, but like if one message goes out, we should cover the whole population and have consistent messaging. So they're not calling like, well, they said this and they said this, because that seems to be the problem right now.
You know, that sounds good. I think with regard to Metro Mobility ADA and HSPs, that makes sense. I think fixed route is a different message.
Okay, good. Thank you so much. And then we'll keep you guys posted. And I'm so glad, Laura, you said emergency management, because that's my background too. And I'm like, just give me 4 nurses. Like my staff will do all the admin, like all the admin side, scheduling people, the paperwork. We have 1 ingress, we have 1 egress, we have the resting stations, I have the custodians. Like just give me the staff and I can make it happen. I bet I could get 500 people through there in a day, because that's my background. Like just give me the materials and we'll make it work.
Yeah. Like I said, we need a bunch of ice cream trucks. That's it.
Would be perfect.
All right.
Thank you guys all so much. And we do, so I think on the agenda for next month, it will be like a vaccine follow-up share event as one of our points. But I do like having members present, and Melissa had an absolutely wonderful idea. So I'm just going to totally put him on the spot and ask. But Joe V, you are our only member at large. And would you like to present about what brought you to be a member at large outside of, you know, your boss telling you you have to be part of MCC, and what your passions are and how you feel we're like, are we living up to your expectations as a member at large?
Yeah, you are. We keep talking about transportation, which is certainly much more prevalent now that I'm in the senior citizen category, shall we say. But you know, I think the transportation systems are getting better each year. There's a lot more coordination, which has always been a problem with transportation in our area. So yeah, it has, but I have really nothing to present otherwise.
I think you have a lot more to say. You just like to be the silent, strong type on the committee. But do you think maybe next month you could just tell us a little bit more about yourself and what brought you to MCC and where you've seen MCC and where you'd like to see it in the future?
Sure, I'd be more than happy to do that.
Thank you, Joe. Nothing like, I love peer pressure. So, you know, we're all staring at you right now. So thank you. And thank you all just for coming together. And I think, you know, as transit providers, just keep pushing the whole healthcare side of why we want our drivers vaccinated, that we are the ones taking people to their doctor's appointments, and our drivers actually have more contact than healthcare providers right now, way beyond the 15-minute recommendation with anyone. But we'll follow up, and as anybody meets with the health department, let's share that information. And otherwise, I hope you guys stay warm and safe today. I slid down the road from Pueblo yesterday, so I am not leaving my house today under any circumstances. Does anyone else have anything else before we adjourn? Okay, we did give Craig and MMT applause for the transfer station. And before we sign off, I just also want to give accolades to Laura. What Laura's managed to do in less than a year with this 5310 plan is normally like a 5-year journey. And she has come in, hit the ground running, and in the middle of a pandemic and having caught COVID. And everything that can be thrown at her, she's just like hurdled it through. And then MMT has been very supportive of Laura and helping her with the transition. So I just want to thank the community as a whole, that I think we've really capitalized on what we can do during the pandemic. And thank you so much, Laura, for everything you've done.
Thank you, guys. I know it has been a time of patience with us, so I really appreciate it. And I know that a lot of organizations are going through some of this challenge of having to hurry up and run with a lot of things. We're getting thrown several things from the federal government because as things get approved, it goes quickly to our transit FTA and DOT, and then it has to go quickly through us. And so I really appreciate you guys. And I did want to mention one thing, just as a broad state conversation. So those of you who are waiting on CDOT funds or funds that have been transferred through CDOT, I've been on several calls with the MPOs, and just know that their department that typically manages those grants and funds has gone from a department of 2 to a department of 1. They're looking to hire somebody. And so it's kind of slowed down some of the funding that's coming through CDOT right now. So just be patient with that. And I'll keep you guys updated as soon as they let me know about our funds that are running through us, as well as funds that are going directly to you guys. Know that there's maybe a little bit of a delay in that.
Great.
So we're all going through transition.
But thank you, Laura, and thank you for just jumping in and helping our community so much. We couldn't have done it without you. So we will go ahead and adjourn at 10:41 today, and I hope you guys have a wonderful rest of your day.
Thank you. Thank you, Jillian. Bye.
Stay safe. Bye, guys.
Thanks, everybody.